Nobody is going to cut into my scrotum when I am awake. I'm sure of it. Should you be awake or asleep for your vasectomy? Let's talk about it. Hey guys, Dr. Segal here. So the question is, should I be awake or asleep for my vasectomy? I just want to be asleep for it. So let's talk about it. At the end, we'll talk about kind of the way I would recommend that you advocate for yourself in terms of whether you want to be awake or asleep, the best way to approach your urologist about that. So stay tuned at the end for that. The first thing I'll tell you about the vasectomy is, at least on the guys that I do vasectomy on, I would say over 90% of them are awake. There's a variety of reasons for that. It's just a lot more convenient for them. They can oftentimes drive themselves home, etc. And most guys do just fine being awake. Having said that, there are certain circumstances where I actually recommend that they get some sedation or go to sleep for it. The two biggest ones are, number one, we always do an exam before the vasectomy. If I'm trying to feel those vas deferens and it's really hard for me to feel them, then I say, you know what, maybe it's better if you get some sedation, you're asleep for it. Because to be digging around in there to find the vas deferens while you're awake is uncomfortable for you. It's uncomfortable for me. So oftentimes I say, let's just give some sedation so that we're both more comfortable, frankly. The other reason why is if you have any history of passing out, any fear of needles, any of those things, then we just give you some sedation for it, because we don't want you passing out in the office or in a position where we don't have an anesthesia team, etc. And I've learned that the hard way. So, I always ask the guys, now, do you have any history of passing out? You okay with needles? Do you get squeamish with anything? If the answer is yes, bam, we're going to give you some sedation for it as a general rule. A lot of guys say, well, doc, I don't want to be totally asleep for it because that's a whole rigmarole, but I can't imagine just going in there totally awake either. Is there any in-between option? And one in-between option I think exists is like what we call an anxiolytic, or a medication that'll relax you a little bit, something like Valium. I usually tell guys it feels like you've had a few beers, that sort of thing. But guys get a lot of success with that because it takes the edge off for them, number one. Number two, it's not all the way out per se. Number three, you do need somebody to drive you for it, but it's a nice in-between option. So consider something like that. Consider asking your urologist about something like that. Not quite awake, not quite asleep, somewhere in between. There's also other logistical concerns with being asleep for a vasectomy. There's almost always an anesthesia cost, which can be extremely variable depending on the anesthesia team, the insurance, etc. You have to get a driver too. The majority of guys I do vasectomies on, they drive themselves there, they drive themselves home because they're awake for it. But if you get sedation for it, then you have to arrange for a driver. And oftentimes that's difficult for guys, right? I mean, you're in a position where you're married, you have kids. Now your wife's usually watching the kids, so it's hard to arrange a driver for it. So that can be a challenge logistically for going to sleep for it. One reason this isn't always talked about, why I like guys sometimes to be awake, is because when I do a vasectomy, I will give a nerve block. So I'll give numbing medication alongside the vas deferens. When they're awake, we can ask them, how much is this helping you? After I gave you that nerve block, are you feeling anything down there? And if they're saying, doc, I don't feel anything, I'm good, you know that nerve block was in a perfect position. If the guy's asleep for it and you give the nerve block, you're doing an anatomic nerve block based on where you typically give the numbing medication, but you can't talk to the guy and ask him whether you're, quote, hitting the exact right spot for it. So the nerve block's important because it does give them some relief after the vasectomy. So if they're awake, you get to have a conversation with them and make sure that nerve block is in a perfect position. So that's one kind of what I think is an added bonus of being awake, to make sure that nerve block is as perfect as it can be. And this is the pearl at the end that I always tell the guys. There are some guys that they absolutely want to get a vasectomy done, and they heard everything that I said there, or they hear all the good things about being awake for it, but they say, no way, I want to be asleep for it. And they're somewhat skittish, or they're worried about talking to their urologist about it. Usually what I tell them is, what I'll tell you guys is the line that you should tell your urologist to make sure that they sedate you if that's absolutely what you want. Say, I'm going to be more comfortable. You're going to be more comfortable. Let's make both of our lives easier. So if you tell them that, oftentimes that'll be a good advocate statement so that you can have sedation if you want to have sedation. So that's my parting shot. Hopefully that's helpful for you guys to determine whether you want to be asleep or awake for the vasectomy. You're going to do fine. I want you to know that. Thanks so much for listening to us. Please subscribe to our channel. That's it.